Whooping cough vaccine is now free for all pregnant women in New South Wales, following new clinical evidence that shows it is safe in pregnancy and protects newborns from whooping cough. Trends indicate that pertussis outbreaks occur every 3 to 4 years in New South Wales. In the last several months, cases have increased, and there have been 36 in babies under 1 month so far in 2015. The National Health and Medical Research Council has recently released new recommendations for pertussis vaccine for pregnant women. The Council recommends a single vaccine dose in the 3rd trimester, ideally at 28 weeks. This will provide protection for the mother for the remainder of pregnancy against whooping cough and for her newborn baby for the first 6 weeks before the first vaccine dose is due. Research involving more than 40,000 pregnant women in the US and the UK has shown that pertussis vaccine is safe in pregnancy. There were only the usual mild side effects of a sore arm or some redness at the injection site, and no evidence of any increase in pregnancy complications. Free Boostrix vaccine will be offered to all GPs in New South Wales to give to pregnant women. The vaccine can be ordered along with the usual monthly vaccine orders. The free whooping cough vaccine in pregnancy is the single best way to protect newborns from day one, with studies showing it is more than 90% protective against whooping cough. It's important to also give influenza vaccine to mothers at this time because this protects the mother and the baby against the flu. GPs and others working in general practice are also at higher risk of exposure to whooping cough and need to be vaccinated to protect you and the patients you care for. For more information, see the New South Wales Health website.